The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Wonderfully Made. My name is Dr. Christine Salter and I'm board certified in family medicine and I'm in private practice in St. Louis, Missouri. Today we're going to be discussing about a simple home remedy called activated charcoal. And we have a guest with us, Mr. John Dinsley, who's written a book about charcoal. John, I'd like to welcome you to our program today.
Dr. Salter, it's a pleasure to be here with you.
So tell me, why did you write a book about charcoal?
A good question. Why would anybody want to write something about what's left over from your campfire?
Exactly.
Or from your wood stove? Well, charcoal, as you said, activated charcoal or medicinal charcoal, actually has been used for many, many years. Even 1500 years BC, the Egyptians were using it to control wounds, infections, odors. But in the end of the 20th century, there was a tremendous interest in simple, natural home remedies. And because of my experience with charcoal, my traveling in different countries, that's where it all goes back to.
Well, that sounds really interesting. So you've traveled in Guatemala and in other places, Nepal?
Yes.
What
real
experiences
privilege
did you have?
to work there. And in working with the doctors there, the different healthcare providers, especially learned the importance of a good health program. But when it came to treating disease, they instilled in me this notion that I needed to be the gatekeeper of my own health. The people that they treated oftentimes were living remotely from where the clinic was or the hospital, and they did not want to put a dependence upon these people on the doctor, on the healthcare facility, because these people were so remote. They needed to be able to treat themselves oftentimes because it took maybe half a day to get to the nearest road, a couple of days to get to the nearest hospital. Emergency care was obviously out of reach. They needed something that they could use where they were.
Where they were. Well, I think that's true for here in North America too, and in the other more developed countries. We do want people to be gatekeepers of their health and to do what they can do in the home setting, even prior to seeing a physician.
Well, a lot of people are asking the question, you know, with drugs that are readily available, over-the-counter prescription, why should I even think about using something like charcoal?
Charcoal.
But I would like to take a look at our graphic here and look at some of the reasons why we today might want to think about using a simple natural remedy. On our list we have iatrogenic death, nosocomial disease, plagues, cost, and calamities. Well, the first two, iatrogenic death and nosocomial disease, it's actually a subgroup of iatrogenic death. And these are deaths that originate in the hospital because of complications in either administering of drugs, surgery, and so forth. And these are large figures. According to the Journal of Medical Association in the year 2000, 225,000 people died because of iatrogenic death. So obviously, it's sort of like friendly fire.
Right.
You know, this is obviously not intentional, but there are consequences to using
properly prescribed medicines.
Yes. And so people are saying, is there something that I can use as an alternative that doesn't have the side effects associated? And if we used more heroic methods of treating disease right off the beginning, what are we left with in an emergency? People are developing, diseases are developing resistance to a lot of drugs. Some diseases are triggered by antibiotics, and so we know this. What can people do for themselves that is safe? That's
safe. That's absolutely true. Antibiotic resistance is very concerning, rising at an alarming rate. A lot of patients, they come to physicians, you know, they may only have a viral infection, but they want an antibiotic because they want to feel well right away. And what happens is that we're under pressure to prescribe, and we really have to hold our ground. I have to hold my ground and say, well, let's allow your body, it's a virus, you know, we don't have an antibiotic for a virus. We want the body to deal with this, run the fever and that whole thing. And then I like to have a simple remedy that I can have them do in the home that will make them feel better. Because basically they want to feel better, and they're thinking in their mind that if I prescribe an antibiotic, that's going to make them feel better. And more often than not, they take the antibiotic and, oh, I'm not any better. Well, it's not going to treat the virus.
We're cultured that way in society to think that way, but there are safer alternatives. And charcoal is a simple natural remedy that, as far as we know, has no serious side effects. Our body does not digest charcoal, and so it's not assimilated. It's whatever serious side effects that have been noted in the literature are usually associated in hospitals. And today we're talking about home application of charcoal as a simple home remedy.
So how does this work? Is there any science behind this?
Oh, there's lots of science. I'm sure you've read in different medical journals, the JMA, the Lancet, Clinical Toxicology, just to name a few. These journals have picked up on this amazing ability for charcoal, medicinal charcoal, activated charcoal, to absorb poisons, toxic waste products from cancerous wounds, not just accidental poisoning in hospitals, but for instance, poisonous plants, mushroom poisoning, amanita, or insect bites, the brown recluse spider. Sometimes it can stop anaphylactic shock from people who have been stung by a bee or a hornet. I was reading an article recently by an allergist in Canada, one of the foremost allergists on peanut. And he was saying that clinically they've been shown that charcoal can absorb the peanut protein allergen in 30 seconds. So clinically there's a lot of research to show why it should work in the home. And so that's what we're talking today about, the home application. Now, a lot of healthcare professionals, including yourself, have used charcoal. You use it on a professional basis for accidental poisoning in emergency rooms. Poison control centers recommend it. It's used in kidney dialysis machine. I've talked with even nurses, and they don't realize that the kidney dialysis machine is actually a bed of granular charcoal, and the blood is filtered through that, and it's clean because your kidneys have stopped doing the work of cleansing the blood. Interestingly enough, Dr. Hillebrand, who's director of liver transplant at Loma Linda University Hospital in California, has developed a liver dialysis machine to do similar to what the kidney dialysis machine does. When the liver has stopped functioning or it's overloaded, it can't perform its job properly of removing...
Eliminating toxins.
Exactly. So if a machine can do that using charcoal, can we use it in the home? It seems to imply that yes, we can. And again, here in North America, we can often access good healthcare facilities. But many of your audience live in developing countries where I've worked, and they don't have that accessibility.
The access to healthcare, but also even here in North America and in some of the other developed countries, people in rural areas and in some of the urban areas don't have access to healthcare. Well,
whether you're in a city even parked next to a hospital, I bet you have a fire extinguisher. You know, we never anticipate or expect a fire in our home, but we carry a fire extinguisher for that emergency. And if the poison control centers are telling us we should have charcoal in our homes for accidental poisoning, as we mentioned amanita, the poison mushroom, doesn't it make good sense? Then we should have it in our emergency kits. But we talked a little bit earlier about some of the other reasons why we should have charcoal in the home, and I'd like to put up the graphic on calamities. Now, we've seen a few of those recently.
Yes, we have, very sadly.
The earthquake, the tsunami in Indonesia, and then closer to home we had the Hurricane Katrina. I was listening to on the news, and it was saying it was like shock and awe. As the hurricane came ashore, it took out communications, it took out transportation, it took out emergency facilities, it isolated communities, and then it cut off retreat. And we would like to think that would never happen in our neighborhood. But whether it's a flood, whether it's an earthquake, some of these calamities are coming closer. Wouldn't it make good sense to have not only a first aid kit? A lot of these people didn't even have a first aid kit, but they should have charcoal in that first aid kit along with them. And
we really want to encourage our viewers to make sure they do have a very good first aid kit in their home.
Sure.
That would include activated charcoal. Tell us what it means for the charcoal to be activated.
Okay, well, you take raw charcoal, you've put your campfire out, you're out camping, you put the fire out, you have charcoal left over. Now, charcoal can come from any number of plant sources. You can oftentimes take coconut shells or bamboo, olive pits, peat moss. They take this initial charcoal and then they subject it again to very high temperatures, 800 degrees Celsius, and then they bombard it with steam or air, and it erodes this internal structure of the charcoal molecule, giving it a tremendous surface area.
Surface area.
Oh, yeah.
Yes, you know, the standard dosing in pediatric poisoning is 50 grams, which is like 5 tablespoons, and that's actually equivalent to 10 football fields. So we can see how when the charcoal is activated, just how much surface area there is to actually absorb all these toxins. And we say adsorb, A-D-sorb, not absorb, because it sucks these toxins onto its surface and all these meters of surface area. So it makes it very useful.
And it holds those poisons until it's eliminated from the body. Now, charcoal is known to absorb over 4,000 natural and man-made poisons and toxins. And that unique feature is used every day in the hospitals, but it has the other flip side to that.
Right.
Drugs, when we overdose on drugs, we want to use charcoal to bind those excess drugs because somebody's overdosed. Charcoal does not discriminate between poisons, and a lot of drugs are definitely poisonous. And so if somebody's taking a medication, they want to be aware that their charcoal, if they're taking charcoal, it's not going to discriminate between their medication and other poisons, toxins in their body. Exactly. So they'll want to give themselves, depending on who you're reading in the literature, they'll say anywhere from 1.5 hours before, 1.5 hours after you take your medication. Give yourself that window for your medication.
Yeah, or even up to 2 hours.
Could be,
yeah.
Yes.
So you want to keep that charcoal away from the time that you're taking prescription medicines, because it will suck those medicines too.
Yes.
And make them ineffective.
If you're concerned, you should talk with your physician. Again, if you can't take it internally because you're worried about it compromising your medication, you may apply it externally.
Externally.
It can be done in baths. A warm foot bath, you can add charcoal to that as a detoxifier. For instance, gout. I was working on a remote island in the Pacific, and we came into this island one evening, and we were under this large shelter called a maniaba, and the minister came in. He came in stumbling, and he was grimacing with pain.
Oh, sounds like
I
gout.
looked at him and I thought, oh, what's wrong? And he says, oh, my big toe is killing me. I have not slept for weeks as the pain is so severe. And I'm not a physician, but I started thinking, I wonder if maybe he's suffering from gout. And not knowing, we made a foot bath with charcoal. Now, it wasn't this wonderful activated charcoal that is accessible here. We're on a remote island. I found some crude charcoal. We pulverized it, put it in the water. I did have some charcoal capsules that I brought with me.
Okay.
I gave that for him to take internally. The next morning, I came down the path, and here's the pastor grinding up charcoal to make a hot foot bath. It had worked for him. So it had absorbed the uric acid that crystallizes out in your extremities in gout, had absorbed it through the skin. And so you can see that charcoal does work internally, but it also works externally.
So
poultices and baths.
And I think that pastor was very happy with you. I think you'd be his best friend for clearing up his gout. Do you think he would want you to wait until there was a randomized, double-blind controlled trial to prove that activated charcoal pulls uric acid through the skin?
Well, it's very interesting information. You know, you can read all this, but it's a lot more friendly to use it yourself. And I guess we're trying to acquaint our audience with this simple remedy. For many of them, it's what you might call off the wall. It's something brand new to them. But we're hoping that it begins with experimentation. We talked about being a gatekeeper. We are giving you the assurance that there are no side effects, major side effects to charcoal, no known side effects to charcoal. It's something simple you can use in your home. Again, it's used in hospitals as well.
Right. So we know that it is very useful, and sometimes when we know that something's useful, we can extrapolate and use it for other things, and we don't have to wait for those randomized double-blind controlled trials. We don't even wait for all those for half the drugs that we're using.
Well, we talked a little bit earlier about calamities, and maybe throw up the graphic now about aftershock. You know, when there is a calamity, war or earthquake, so forth, very quickly we find ourselves in a situation with poor sanitation, water contamination, power failure, transportation failure, spread of disease, and depending where you are, the availability of medical care. If you have something in your home, you can start right now as you wait for emergency care to come to you.
You've spoken about the concept of gatekeeper. It's important that for all of us that we do become gatekeepers of our own health, of our family's health, that we do have the appropriate supplies there. You know, with the recent Hurricane Katrina, it was very bad because the hospitals were flooded, you know, and people could not get to the appropriate medical care.
Well, when you think that water is filtered through charcoal all around the world, from Olympic aquariums to our drinking water, up in space, the space station uses charcoal to clean their air and their water, their nuclear submarines. So it filters water, it cleans water, dirty water. It's used in wound dressings. Johnson & Johnson has a wound dressing with charcoal in it. The soldiers in Iraq have charcoal in their clothing to absorb potential chemical warfare. But where do you get charcoal here at home?
I was going to ask you that.
Well, if they don't have it, go to the pharmacy. I say if they don't have it, ask them, and in most cases they'll be glad, they'll be happy to bring it in for you. Health food stores and co-ops often have it. You get it in capsules, tablets, powder, sometimes even as salve. It's also dispensed in the poison control centers in a suspended solution. They just shake it up and give it to you immediately. But you know, in a home, if you keep it in a dry, well-sealed container, it'll last indefinitely. When the occasion arises, you just add it to the water, stir it in, and drink it back.
I've had charcoal under my kitchen sink for years, and I use it for various things: sore throat, gastroenteritis, ear infection. So I've used it for a variety of things. It's not a substitute for medical care, but sometimes it can
tide you over
until you get that opportunity to go there. You see, so
the other area I should bring up, because we all like animals.
Right.
In the story, one of the stories in my book, I tell about this lady who operated a camel expedition around Australia. She had 5 or so camels, and this one day they stopped at this place, this oasis, and they put it in this compound, and there was a tree there that the lady didn't realize was deadly poisonous. And one of her camels, she called it Greedy Gut, went over and started munching on this tree, and then before long it was laying down on all fours and couldn't get it up. And she, in the process of trying to think what she could do, she remembered charcoal. And she gave charcoal to it. But it seemed to help, but she tried other things as well. Eventually she came back and got some more charcoal, gave it again, and she was convinced that charcoal definitely helped. So much so that farther down the trail, again, one of the other camels ate something it shouldn't have eaten. She again applied the charcoal, and she said charcoal was the remedy. But when I looked at the weights of her animals and the amount of charcoal she was giving, I'm convinced that if she'd given a lot more, those camels would have responded much quicker. There is a dosage. It's in the animal poison control centers, they recommend anywhere from 1 gram to 3 grams per kilogram of body weight animal. When doctors prescribe charcoal, they sometimes, to people, they usually come up with 3 recipes or dosages. One is the one you mentioned, anywhere up to 50 grams for a child. Another one says 10 grams of charcoal for every gram of poison that you've taken. But how many of you are going to sit down and say, well, I think I, 10 grams of charcoal? Give lots. You can give too little, but you can't give too much.
And as long as you're given lots of fluid with it,
yes,
also,
you'll have no complications.
No problems with that.
So yes, the animals is another whole area where we could be giving charcoal. A lady who had read the book mentioned that she went home and decided she was going to do her own experimenting, but not on herself. She had an old dog, and she described, I didn't see the dog, she described this softball-sized growth in its abdomen. It made it very uncomfortable for the dog, and she thought, well, I'll try charcoal. Can't hurt anything. So she wrestled a capsule of charcoal, activated charcoal, down the dog's throat every day for 6 weeks. Okay. Now, I never saw the dog, but she said after 6 weeks, she says, I'm convinced it worked. For whatever reason, she says it's down to the size of a golf ball. And she decided rather than using capsules, she'd get some powder. It's a lot more economical. It's cheap. And she would use that. She'd just mix it in with the food. I said, well, actually, they've been doing that. They do that on a commercial basis. They, in some large animal factories, they'll add charcoal to the feed, prevent them from bacterial infections and so forth.
Yeah, there's been a study in the American Journal of Gastroenterology that talks about how activated charcoal absorbs intestinal gas. And that is very effective. And so that whole idea of absorption and that large surface area comes into play again.
With animals.
There's nothing, I don't think there's anything magical about charcoal. It's simple, it works.
And it's scientific.
It's scientific. It's really pulling through electrical forces. It pulls materials to itself and then hangs onto it.
One thought that came to my mind is when people do go down to purchase charcoal, on the bottle, they will see activated. That's the first thing they want to see is it's activated. There is another grade up from that called USP or US Pharmacopoeia grade, and that simply means that that charcoal has been washed, acid washed, to remove some of the ash content. It's a more pure form. In fact, the pharmaceutical companies use that grade of charcoal to clean their drugs, to take away objectionable odors or colors from their medications. On the bottle, you will may also see it listed as a food supplement. Well, charcoal is not a food supplement because we don't digest it, we don't absorb it. Well, they're sort of it's a conundrum. They don't know what to do with charcoal. It's not a mineral, it's not a supplement, but because they don't know what to call it, they call it a food supplement. It does not absorb minerals and natural minerals and vitamins. There is some anecdotal evidence that it does absorb some man-made artificial vitamins and minerals, but
so with food, it's not going to absorb the natural nutrients.
The food industry puts it in licorice. They put it in jelly beans. It's in caviar. It's in mascara. It's used in many different ways. People who lose their lower bowels, they have a colostomy. For years, they used to give charcoal to these individuals to be able to handle not only the indigestion, but also the gas that forms. Now, they make ostomy bags that actually have charcoal filters on them to be able to handle that. But previously, these individuals used it on a regular basis and showed no signs of nutritional compromise. So you can put that fear to sleep. Again, if you're drinking adequate water, you're having a good balanced diet, so forth, you have nothing to fear.
So we're not just talking about using on an emergency basis. It's not like, instead of going to the emergency room, I'm going to take this. It can be used for just something simple. You know, sore throat,
Yeah, I know.
pink eye.
Yes, some lifestyle programs that I've been involved in, they used it as a general detox. People who wanted to get off drugs, street drugs, they wanted to detoxify their body. I know of one individual who her doctor gave her charcoal in a Dixie cup every day to take, mixed with olive oil, because she developed Crohn's, very severe Crohn's. And with the Crohn's, there's a diarrhea forms.
That's right.
Along with some of these other diseases, irritable bowel disease.
Why
and so
don't you
forth.
let me tell the viewing audience about Crohn's disease. Crohn's disease is an inflammatory bowel disease where there's a lot of inflammation and sometimes ulceration and a lot of diarrhea. It's very uncomfortable and disabling to patients, having to run to the bathroom, having to be close to a bathroom. And so to use something simple like activated charcoal makes a big difference to them. So
Absolutely.
that Crohn's disease.
Another thing that comes to mind is open ulcers. It can be caused from any number of things. When I was working on this remote Pacific island, I got strep infections on my leg. It wasn't the flesh-eating kind, but it literally ate out holes on my leg. And I used charcoal, and it didn't do very much for the pain, but it did take care of it. Once I realized what was happening, it stopped the growth of the infection, and it did start to promote healing. People who have geriatric cases where they end up with these ulcers that don't seem to respond to anything. Oftentimes a very mild foot bath with charcoal will help to retard the growth of the infection and promote healing.
And that's using not only activated charcoal but some simple hydrotherapy.
Exactly.
That's another simple home remedy used in combination together.
Right. Well, these are simple alternatives. They make us the gatekeeper, as you mentioned earlier, of our health. We certainly can take advantage of the wonderful advances in healthcare that we've seen over the past century. But what do you do when you're away from home, away from a facility where you've come to depend upon it all the time? Should you carry it with you? Wouldn't it make perfect sense that not only do you have it in your home, but if you're traveling overseas, I know many non-governmental organizations that are working overseas, on their checklist they say bring activated charcoal.
Yes, absolutely. Right. In fact, my patients who are traveling, that's the first thing I tell them, to make sure they've got in their travel kit, and they say, what's that? Okay, and a quick explanation, they say, I'll take it with me. And they were very happy to have that activated charcoal, and they did well.
I bet they did.
And so we don't have to wait for those randomized double-blind control trials. We have a nice, simple home remedy, activated charcoal. John, you've given us a lot of good information today, and we just thank you for coming and sharing this information with our viewers. And to our viewers, we want to say to you, if you want to know more information, please contact 3ABN so they direct you to the correct resources. And may God bless you as you use these simple home remedies.